Welcome back to RFD Today on a Thursday. I'm DeLoss Jahnke. And we'll go on the phones, not too far from studio, in fact, but Dr. Natalie McKee. She is a doctor of audiology and owns Be In Audiology in Bloomington-Normal. How are you?
I'm good, thank you.
The whole Laurel Yanni thing piqued my interest mainly from the standpoint of it really opened the doors to talk about hearing loss and just the need to keep track of things like that. Did you guys take an interest in that?
It was a hot topic on our Facebook page for a couple of days. Yes, most of the office was Team Laurel here.
I was Laurel, too. It was loud and clear Laurel, wasn't it?
Yeah, well, that's what I thought, too.
Yeah, that's fascinating. Because we brought in a couple different people, and they heard two different things than the Laurel that I had heard. If you don't mind, this is something this is personal for you. This isn't just the job necessarily, but I think part of your inspiration and to do what you do came from your own experiences.
Yes, I do have a hearing loss in one of my ears. It's not related to noise exposure. It was more related to an infection that I had when I was younger, but it caused me to lose over half of the hearing in one of my ears. So I've felt the trials and tribulations of that since I was very young, and it's helped me kind of understand what my patients are going through. We also have another audiologist that has hearing loss in both ears here in the office, so she also can relate to that experience as well.
It's interesting, thinking about this from an ag perspective, from a farm perspective. I can think of standing by the feed grinder. To grind feed, you have to run the tractor at full throttle, and that means a lot of noise. And not only that, it is a particular noise. Full throttle tractor basically all has the same pitch. So I think that could also have an impact.
Yeah. So sometimes it only takes a few hours to start laying the groundwork for a permanent issue down the road. And I think that's the challenging part with educating the agricultural population, is that it's a very cumulative experience in that it can start when you're very young and not present itself until years later when it starts having more of an effect on your daily life and communication abilities.
Mm-hmm. And then with what you deal with, then some people are just in general losing hearing, and then some people, because of things like that, may have certain frequencies that just don't register anymore?
Yeah, so there's always the age-related issue. So as we age, our hearing does decline, but being around noise certainly will expedite that much sooner. We're seeing hearing loss with impactful results on farmers in their 40s and 50s, and age-related, we usually don't see that until 60 or 70. Yeah. So you can see how it really speeds that process up. 40s,
let's say I may be in that boat in my 40s. But to think, I'm not old enough to have something like that. I'm sure you get that sort of reaction, or that people might even be reticent to even come into a place like that because they are in their 40s or 50s.
Yeah, and we try to be as low pressure as possible, and more of a just get it done diagnostically to see where you're at, because you can slow it down. No matter where you're at when you come through the door, we can help you either stop it or slow it down by educating you on what you need to do around those things. But a lot of times it also presents where people say, well, I only have trouble when I get in a group situation or when it's noisy. That's typically the first complaint that we hear, but otherwise they're fine.
Yeah. Huh.
And that's kind of how high-frequency hearing loss develops, is you start having challenges in more dynamic environments where there's other competition, or maybe there's some distance without microphones.
Yeah.
And that presents first.
Huh. From what I was doing, it's not like we could avoid then running the tractor at full throttle. So like some of the people that you're seeing can't make a complete career change or something like that. People that might have a jackhammer, or someone, I'm thinking like state highway crews or demolition people, or, you're around these things, and I need to continue to keep this job. I don't want to turn everything upside down, but yet, so I'm still going to be exposed, and what do I do?
Yeah, well, a lot of it comes in the protection. You're right. You can't make the equipment quieter. You can't make the process quieter. Although I will say tractors are much better, because I've got guys that say, I used to drive tractors with straight pipes and no cabs, and now we've got combines with refrigerators in them. So they're certainly making improvements in those engineering controls. But the best thing you can do is think preventatively and use the hearing protection.
Yeah, because that wasn't something that would even dawn on me, that you wear a cap to prevent yourself from the sun, but you don't do anything to prevent yourself from noise.
Yeah, a lot of people worry about, they'll start wearing hats and protective eyewear before they'll grab that hearing protection.
So when we do have these sort of hearing losses, especially in a crowd, and I know, having worn headphones doing radio for as many years as I did, and I used to really have the headphones cranked for it, and knowing that it was going to do me harm. Yep. But I would have the headphones turned louder than they needed to be. And now you get into a crowd, and it's just a bunch of mumble jumble sort of thing. So I assume the natural reaction is to try to withdraw yourself from that sort of thing.
Yeah, when we see patients that start having those challenges, they'll just say they nod and smile, or they'll just let the conversation go on. They don't want to interrupt or make it look like they're not paying attention. Yeah. So, they have to do a lot of coping and compensating or they'll just wait and ask a spouse when they leave the event, what did they say or what happened? I didn't catch that, kind of a thing. Yeah, or you're in a group discussion and you say something that may sound like a non sequitur, or it sounds off the wall, and like, man, what's wrong with him? And it was just because you misinterpreted things or just didn't hear properly, and now you don't want to participate in those nearly as often. Right. Now, is it something, is any of this healable, if that's a word, or is it something just to maintain, because a hearing loss doesn't seem like something that could easily come back? Yeah, right now those structures in our ear are so deeply embedded and minuscule that we do not have the magic pill to fix them at this point. So we're getting better at things like that, but we just don't see it in the very near future. So the best thing to do is preventative, because once it's damaged, it's usually permanent. Yeah, just like so many other things. We only have one heart. We only have a certain finite number of. We have two eyes. We better take good care of them. That sort of thing. Yes. And especially, I'm sure you see people that they may be well advanced by the time they finally get around to coming to you. Yeah, most people wait 5 to 7 years after they notice the first signs. That's the industry average right now. Yeah, I can understand that. Unfortunately, there are some doctors that don't necessarily rush to go to, especially a specialist might make things even more difficult. Would that be fair to say? That's fair to say. And I think the other fear is that if they already suspect something, they don't want to think about, it takes a lot to come to grips with getting the test done, and then they've got to come to grips with, okay, now what do I have to do once we put an actual label on this? Yeah. Knowing that, I'm sure, has an impact, and having gone through this yourself, certainly has an impact then on how you would treat patients when they come in there, because no one says, hey, let's go see the audiologist today. Yeah. Yeah. We'd like it if they would, though, because we're not scary. Sure. We don't have needles or anything like that. Hey, well, now what about, so my 12-year-old has earbuds popped in all the time. Mm-hmm. And I'm just thinking, man, what's that going to do to my kid when he's 40 or 30? You know what I mean? Right. So we try to tell the teenagers and now adults, everybody with these Bluetooth pieces and things that they walk around with in full time, the best thing you can do is get a good fitting earpiece, because that's going to seal your ear canal up so you're not turning up the volume in order to hear over what's in your environment. That's the first thing. And then the other thing is just, again, watching the volume, especially with music. A good rule of thumb is you probably don't want your volume higher than 60% if you're listening to it for an hour or more. And just taking breaks. Take a 15-minute break from the earbuds every hour or so is also a good rule of thumb. Your ears need some rest. And I could have earbuds on in the tractor, while I'm going to be in the field for 3 hours. So I can think so many times, even in the car, you run the car with the windows down and you turn up the radio, and now you got all kinds of things flying in your ears. The one thing to remember is it's not just the volume; it's the time that's involved that you're doing it. So that's why it was not only that 60% volume, but also that hour marker. So, when you're around farm equipment and things like that, and that's why I said after a couple of hours on an open cab tractor or a lawnmower or something like that, that's where you start seeing where you can have some lasting effects. If you're just turning it on, running it for 5 minutes, you're probably going to be fine. But those longer-term, all-day type situations are where you can really see some significant long-term effects.
And I would think a lot of audiologists are in more of a metro area, which could be, especially for farmers, could be an additional challenge.
Yeah, well, we're here in Bloomington, but we also have an office in Pontiac as well.
Excellent.